Hi, and welcome back to Dogs Do Speak podcast with myself, Colin Spence, and the wonderful Samantha Wayland. And today we have a wonderful guest called Leisl De Lafontaine. And Leisl is here today to talk to us about therapy dogs. It's a subject we don't really touch on very much. However, Liesl is going to tell us what is a therapy dog, why we have therapy dogs, and how beneficial they can be. So, without further ado, we're going to go over to Liesl. Welcome and thank you for coming along today to join myself and Samantha on Dogs Do Speak. And can you please just introduce yourself for the wonderful people that will be watching?
Good morning, guys. Thank you very much for that introduction. So my name is Leisl. I am what I would class as a visiting volunteer with Therapy Dogs Nationwide. And along with my Cocker Spaniel Tassel, we visit our local community to bring distraction, joy, generally smiles to those that we meet.
Okay, so how did you get into that role? What brought you to it? What made you think one day, Liesl, I want to be a therapy dog volunteer?
Okay, so I'm sure you'll agree we all have the best dog in the world, and nobody is wrong. And probably like many others, I wanted to be able to share and give back with my dog to people who are maybe not less fortunate, but not in a position to embrace maybe having a dog or going through a difficult time, etc. And therapy dog work has long since been proven by interacting with an animal, so it's classed as animal-assisted therapies, that it actually produces oxytocin, which is that feel-good hormone that we all get when we're in love with something or touching something, sort of like tactile. And so I decided that, yes, I can do this with my dog. I had to go through an assessment because although we may have the best dog in the world, and they may be great playing with the grandchildren in the garden or playing with little Johnny on his while they're out for a walk, they may not like, sort of like different noises, different smells, different environments. So we go through what we call a temperament assessment to make sure those dogs are bomb-proof and they're not just tolerating being interacted with, but they're really enjoying being stroked and interacted with.
Okay, so are there special places that a therapy dog would be attending, or are they just specific spaces?
So for therapy dogs nationwide, our core work will always be the things like schools, residential homes, hospitals, hospices, funeral parlours, etc., whereby, sort of like we've had a request from that establishment and they need the dog to go in for moral support, companionship. Sometimes we work with clinicians with regards to phobias. So we're actually going in on a regular basis and interacting with clients, patients, children, etc. However, we also, as they're a part of Therapy Dogs Nationwide, we also get involved in sort of like big corporate hospitality days where you're doing staff well-being, mental health days, etc. And so our dogs will go in and be part of that for members of staff or the board.
I absolutely love that. I've seen a lot more posts recently of places like even police, or my local police force. They have a dog that will go into different offices to sit with the staff, as part of their sort of their mental health thing. And I've also seen recently a post from some of the rescues that I work with in Cyprus, where they've been bringing their dogs that have been tested into the local airport for people who were scared of flying, which I thought was amazing, because if you've got that nervous feeling, and like you said, you then get to go and sit with a lovely dog and you get to stroke them and you get that, those feel-good hormones going again. And I think that's such an amazing idea. It's brilliant.
Yeah, we've recently had a first whereby a dog went into the dentist to sit with a young lady who was terrified about having quite some extensive sort of like work done. And they built up to it, and the dog actually went in and actually sat and she stroked the dog while she was having her procedure done. Now I have to say that was quite unusual. But yeah, used in all sorts of situations, and just the presence of a dog, or almost like a third party. It's like you don't have to have the interaction with the person. You can go via the dog, and it just automatically starts calming people, and just taking the focus away from something that was probably quite intense or quite emotional.
Yeah, I like the way you've described that, because I know I'm neurodivergent, and I know a lot of I'm okay. Obviously, I'm okay with talking to people. I'm not hugely socially awkward most of the time. Sometimes I really am. But I do have
We all
friends
are,
who
aren't we?
really, yeah, exactly. I do have friends who really struggle with that. That we were talking about it earlier, actually, that's the social events and speaking directly to someone. And I do know that when I'm working with people and I can talk to their dog rather than to them, I do find that easier. So that makes sense I've never thought of therapy dogs in that way, but that really makes sense the way you've described that you can talk to the dog and not necessarily have to focus on the people around you. That's so fascinating.
Yeah, we also work with the court services as well. So sort of like victim support and things. And sometimes when people are giving their statements, then the dog will be in there, and the person will be actually talking to the dog. So there'll be a third party asking the questions, but the person's responding to the dog and sort of like interacting with them. And again, that can be quite traumatic, but it's a bit of a distraction. So a bit of a distraction, a bit of a focus. It distracts from the, sort of like the intensity of it all, and it gives them something else to focus on.
I have no idea some of the places you have just mentioned that a therapy dog would be. The funeral, wow, that that just blew my mind when you said it. The dentist, um, it just goes to show sometimes we think of dogs, or some of us think of dogs just in a training mode, just doing those kind of things that they're not here to do all these other things. Not that I'm saying they shouldn't be, but my brain doesn't go or function that way until we discuss these topics. But the one that does strike me the most is the funeral. How would that work?
Okay, so we have two sort of like avenues that we can go down. One of our volunteers goes regularly to a funeral home, or funeral parlor, and anybody who is unfortunate enough to be going in that day, they have the opportunity to interact with the dog, and the dog can be there as a distraction whilst they're discussing arrangements. Or alternatively, it could just be a one-off whereby sort of like the funeral directors have actually asked us, can you come in and help support this family, whereby if it's convenient and the volunteer is free, then yes, absolutely, they will go in and sit and may not even sort of like interact, but just be a calming presence in the background.
With all that said, as you're talking away there, I'm now sitting thinking, but isn't that also an assistance dog?
Okay, great question. So I think it's really important now to distinguish the difference between a therapy dog and an assistance dog. An assistance dog are what you would typically class as your guide dogs for the blind, hearing dogs for deaf people, dogs for good, the diabetic alert dogs, the medical aid dogs, etc. So they are trained to a very, very high standard, and they are basically serving or working for one particular person. It's really important that we don't interact with those dogs. Those dogs doing a job, and they can't be distracted. A therapy dog tends to be much more like your family pet, who equally is, well behaved, sort of has a decent grasp of commands, but you're happy then to share. So all of our dogs are pet dogs. We've got over 2,000 volunteers who are registered with their pet dogs. The pet dogs will have been temperament assessed, but then they will actually go into their local community. So you could have somebody going into a nursing home, visiting people who have perhaps had to leave their dogs behind, and it's classed as one of the activities. You've got people going into dementia clinics, whereby the dog can actually spark deep-rooted memories about growing up on a farm many years ago, and the farm dog, or it's like a dog that they used to play with. And then we also go into schools with our dogs as well. So again, it's our dog, but we're actually sharing it with the community. So it's two very distinct lines.
Do you know what? My head is saying something completely different here because if I'm assisting someone, I'm assisting them for a reason. And the reason I see here is an assistance dog is helping me emotionally stay safe. Yeah. making me feel okay again. But that word you just said, making some people, possibly if you've got dementia or something like that, go back to those happy days. So I don't know. You can all call me stupid if you like. They're assistance dogs, but I get it. I totally get. I can see the difference
Yeah.
and why therapy dogs will be called therapy dogs, because at the end of the day, all dogs are therapeutic. Yeah, and they're all. When we look at when my wife tells me off, the first thing I do is give my dog a big kiss, and that makes me feel good. Yeah. And when I say tell me off, I don't mean tell me off, but you get the gist of what I'm trying to say. So I resort back to just cuddling and stroking my dog and saying, "Just me and you, bud. Just me and you." so
Yeah.
I get that. So what is the request? Is it a request that we get on a daily basis? Is it busy?
Is it busy? So my colleague Helen and Sarah, they are what we call our placements team. And we have 10 inquiries a day for people asking for visits. So whether that's either a long-term, please can you come into the nursing home or the school once a week, once a month. And then also, as I mentioned earlier, we've got what we call the one-off visits, where we will go and support people where we can. Our core business or core activities will always be those regular local community visits. We don't charge anything for our visits, so it's all being done with volunteer hours. And yeah, people are requesting for dogs all the time. On the flip side of that, we've got an inquiries team, and again, we probably have about 5 to 10 inquiries a day of people actually wanting to sign up with their dogs. They've heard about us, they perhaps have got a bit of free time, and they want to start doing something and giving back with their dogs. It's a really simple concept, but it's highly effective.
Yeah.
And obviously, our dogs they need to be well behaved, they need to be well adjusted, they need to have some like basic obedience and things. And as mentioned earlier, they need to really be enjoying what they're doing. But because it is so simple, people find it just so rewarding. Not only those that we visit, but equally us as volunteers. It's a great feeling to know that your dog has made a difference.
That is really, really good. I mean, how does one then, if they make contact and they have their dog, how does that all start to, pan out? What's the assessment like?
Okay, so when we do an assessment, we give everybody a list of the assessment criteria before we start. We're not trying to catch anybody out. We want you to come and join us, but again, it's really important that our dogs adhere to that assessment criteria. We have to protect those that we visit. So the assessment is loosely based around the Kennel Club Good Citizen scheme. So are the dogs going to walk nicely on a lead? Will they stand quietly while you're having a conversation? They're not jumping up, they're not barking, they're not licking. A big part of it is sort of like touch. So are they happy to be gone all over? Eyes, ears, head. You occasionally have somebody come up and pull a tail. So we really need to make sure those dogs are bomb-proof. The assessment normally takes about 45 minutes. When I assess, I will normally do it somewhere like Sainsbury's or Tesco's, where there's a bit of activity going on. We're not on the dog's home turf. They can see trolleys, they can see cars, they can interact. And what I'm really looking for is, so like, is the dog bomb-proof? And also, what's the relationship between the dog and the handler as well? Is the handler aware of what's going on with the dog? Because that is really important. Once they've gone through the assessment, it goes to a panel of judges within the charity, and we will either accept or decline that dog. We reference the volunteers. We do our due diligence on volunteers to make sure they are who they say they are, and that they can be relied upon. Then, during part of that assessment, we actually ask people, where do you want to go? What do you want to do? Why do you want to get involved? And a lot of people quite often know what they don't want to do, but they don't know what they do want to do. So say, for example, I've assessed teachers who are like, I definitely don't want to work with kids because they're working with kids all day long. So I do not want to go in with kids. Some people are uncomfortable going into the court system. Some of the statements that we hear are highly traumatic. It's really hard work. You've got confidentiality there, and also they might need some support afterwards. So it's like, okay, I don't want to do that. but many people are open to different ideas. And as I say, we have a list of establishments who are waiting for volunteers. So our placements team would say, okay, you've just joined and I see you're in the GL postcode, there's a nursing home down here, it's about 5 miles away, would you be happy to visit? And we get them in touch. We also have what we call area team support, so it's perhaps a slightly more experienced volunteer, so they would go in with that new volunteer on their first time, show them the ropes, what is expected, what's not expected, and just to help them feel comfortable. However, we've had people who are like, we're desperate to go volunteering. I go past the nursing home at the end of my road every day. Please, can I get in there? And if you want to make headroads and get in there yourself, then absolutely fine. We will support you as well.
Wow. So there's a lot, and it sounds like the volunteers got lots and lots of support, which is really good. And yeah, here's a silly question coming up now. What breed of dog makes the best therapy dog? Please say the Rottweiler.
I'm going to say that. I'm going to say
rescues.
Spaniel.
It's going to be. It's rescues. It's rescues.
I think we can all agree to disagree there. So we have no criteria on breed of dog. So if the dog, based on temperament, if you pass the temperament, don't care whether you've got 3 legs, 1 eye, a pedigree dog, and we have 2 3-legged dogs, and we do have a 1-eyed dog as well. You may have a pedigree behind you, or your history is unknown and you've just come over from, as we mentioned earlier, from sort of overseas, and you've been living with your handler for a year, and then in which case we will assess you and take you on board. So no criteria. We certainly try and match dogs with different establishments. For example, when I first started visiting many moons ago, we went to a residential home, which was great. However, they kept feeding my spaniel biscuits, and I don't mean a biscuit. It was custard creams and jammy dodgers and you name it. And I tried saying, oh look, she's just had her tea, or she only wants these treats, or she's not hungry. And bless them, everybody was just saving up biscuits. And sadly we had to stop going there because clearly dog cannot be eating that many biscuits. We then swapped them out. They got a pair of Labradors in, happy as Larry. And we then started visiting the children's ward in the hospital, where meals were a bit more controlled, and there may occasionally be a chip or a pea on the floor, and that's as much as she got. So yeah, we will try and match dogs for sort of like different environments. And some people, please, can we have a small dog? Could we have some big dogs? Have you got anything really furry? If we can, we will.
But they do have that place where they can actually ask for a type of dog, a specific type.
Yeah, well, generally speaking, sort of like for our regular visits, it's like, have you got a therapy dog? And people are just grateful for anybody that they can have. But sometimes, if we're working, for example, for phobia work, somebody will say, please, can we have, sort of like a small, quiet dog? And we'll try and do that. Sort of like nothing against the bigger breeds, but if you're trying to do some phobia work with a clinician, sort of like sometimes sort of like sort of like size matters, or furriness, is that a word? Physique matters, etc.
So going back to everything you were talking about before, and the differences between assistance dogs and therapy dogs, legally, what is the difference for a therapy dog? Where do they stand legally with like entry requirements into places?
Okay, so legally, therapy dogs have no claim to anything. So like most therapy dogs are pet dogs first and foremost. And so it would be like me trying to take although she's a therapy dog, trying to take her through, I'm just going to say John Lewis, but I think John Lewis allowed dogs now, don't they? But yeah, they have no claim. However, if you have an assistance dog, it is a legal requirement for that dog to be able to go anywhere and everywhere. And you are in breach of the law if you restrict that dog from going in your cafe, in your hotel, in your taxi, anything like that. So therapy dogs, we have no rights whatsoever. I like to say we look cute, but that's where it stops. We don't have any other claim.
Does insurance play a huge part here?
Excuse me. Yes. So all of our once people come on board and they're visiting volunteer, they are insured to visit on behalf of therapy dogs nationwide. So there's a huge chunk of our money goes towards insurance every year, insuring our volunteers and their dogs for when they're out and about, and so like third party liability, etc. So yeah, they are insured, providing the dog is on a lead. If the dog is not on a lead, we can't insure them. So we stress to our volunteers that when they're visiting, the dog must be on a lead, and equally you must be on the other end of it.
Yeah, otherwise the dog will always be on the lead, but they're not on the other end.
Yeah.
Quite often there's, so say for example, if we go into a school or maybe sort of like stroke rehabilitation, our volunteers will take a second lead. They will clip that to the dog, and then sort of like either the child or the patient can then sort of pretend that they're walking the dog and that they're in charge. So again, it's great for sort of like occupational health and rehabilitation, and also building children's confidence as well.
Okay, that sounds really, really, really good. I mean, you work with various breeds of different sizes. There's no discrimination there, which is great. Which then leads me on to another silly question, really. Does it matter if they're intact or not?
No, not at all. Not at all. We quite often, so as I mentioned earlier, we have a huge sort of like diverse pool of our therapy dogs. We quite often have dog reactive dogs coming to sign up to work with therapy dogs, because generally speaking, when you are visiting, it is just your dog and you going into an establishment, and it's highly unlikely you're going to see another dog. You might see a cat crossing the road on the way in, etc. So a lot of people who have got dog reactive dogs, they actually quite like doing therapy work, because perfectly happy with people, and they feel that they can actually get out and do things. But because they're visiting by themselves, that's absolutely fine. We are quite social as an organisation. We will quite often do fundraising, sort of like collections at Sainsbury's or at Tesco's or Crufts, etc. And our volunteers are invited to come to that. Now, if they've got a dog reactive dog, they're probably going to decline. But there's no reason why anybody else can't join us.
So can anybody become a volunteer and live anywhere within the United Kingdom?
Yes. So you've got to be over 18 years of age, again, for our insurance purposes. We need to assess you with your dog. So if it was like a husband and wife team, we would need to assess both of you with that dog as well, just to make sure that sort of like both the dog is respectful of both volunteers, and comfy and happy. But other than that, yes, you can sign up. We do actually have what we call our cadet scheme, which is for children between the ages of 7 and 17. They can actually join with a visiting adult, and they can visit with that adult, providing the establishment lets them. We've got the kids will do talks in assembly, and they'll quite often fundraise for us. They will hold dogs at events and things, and that's we really try and encourage that, because the cadets are going to be the future of our organisation. But they need to be enrolled with an adult. And then we also have people who we call our sort of like VIP supporters. So these are either people who don't have a dog, or sort of like a partner of somebody who visits, but they want to be involved in it, or sadly volunteers who've perhaps lost a dog, or their puppy isn't quite ready yet and they want to stay supporting the charity. Then they will stay as a supporter. Again, they can fundraise, they can do various talks, they can get involved in activities as well. But yeah, providing we've got your references and you pass, then yes, we go from, I want to say, Inverness, we've got people on the Isle of Wight, we've got people in Jersey and people in Northern Ireland, as well as England and Wales.
Wow, that is vast. That is vast. And is there a time limit? So a visiting therapy dog, can they be there for as long as they wish, or?
That's a really great question, and that often comes up during part of the assessment. It's like, well, okay, how much time do I need to give? So we've got volunteers who will go and visit somewhere for an hour a week. We've got volunteers who go for an hour a month. We've got some people who go out 2 or 3 times a week, visiting for sort of like quite longer periods of time. All we say is please don't say you're going to go an hour a week and then go, sort of like turn up 1 week out of 4. It's not fair. People really look forward to our visits. It's a really big part of their day. and to not turn up, it's not fair on those that we visit. Obviously things happen, the car will break down, or something's happened. People understand that, but we want it to be something that you are able to commit to. If you can only commit to an hour a month, that's great. Somebody's going to get an hour of your time a month. We worked with the Kennel Club when we first started back in 2016, I think it was, where we put in some guidelines for dogs working in schools. So the dogs will go in to listen to children read and help build literacy and sort of like confidence skills. But it was really important that we had timescales on there. So dogs shouldn't really be working for more than about 90 minutes at a time, just because it's quite intense. And some of the environments, they're very sort of like hot or they're noisy, and the dogs need to be able to be given breaks. And that's why we really pushed sort of like working with dogs in schools rather than advocating for a school to have their own dog. It's really important that they use maybe one of the other organisations where the dog is the sole responsibility of the person visiting. They're not having to look after children or anything else. And sort of like they can actually be tuned into those dogs' needs as well. So if they need a break, they can go out.
Okay. So what would be the most difficult out of the two? Visiting a school with children or going to the hospital?
Having done both, I don't think either are difficult.
Okay.
So there's two different scenarios. So we used to visit two hospitals here in the southwest. One was, generally speaking, the children were quite well. So they were in for elective treatments. So tonsils out, or they've broken a leg playing rugby, or generally something elective or not complicated, not acute. And so the kids would interact. They would put stickers on them, they'd dress them up, they'd play games, sort of like parents would get involved, all the staff would get involved, and they were quite well. The other hospital we went to was a centre for brain injuries, so sort of like neuro injuries, stroke rehabilitation, and burns, so quite severe burns. And we found that, well, not we just found, studies have shown that people will pay far more attention and put much more effort in to interact with a dog than they will to interact with a toy or another person. So, for example, when we used to go and visit in the neuro ward, it may only be, all they're looking for is that the person will either glance towards the dog or maybe smile, or sort of like if we could put a hand on or if we could get a hand on the dog's fur and just get that tactile response, that could be all that they're looking for. But that is huge progress. So that could be quite tiring because that was very intense. Equally, we've got dogs that go into schools who will sit there and read stories, listen to stories being read even. And yeah, some of them are really clever and can read stories. No, and sort of like you're sat there and they're listening. Again, that becomes quite intense. The dog may fall asleep, so we just say that they're really concentrating really hard. But yeah, generally the kids are quite settled. A lot of our schools, before we go in, we will sit down and say, okay, what is the objective? Why do you want a school dog? Some will want it for class reading, so there's just a calming presence in there and the dogs will read. Some will want it for one-to-one, to help build confidence skills for children, or it could be used as a almost like a reward for if you've got disaffected children, sort of like to be used as a reward at the end of the week. You get to read to the dog because you've done your homework or you've behaved, or etc. So it's providing you know what you're going into. I don't think any of it's difficult.
Yes. I just had visions of a therapy dog going into a local school, and the kids are all running into the room and standing up, trying to touch the dog, and you get all these visions. But yeah, you do your homework first, and so the teachers actually support the children in how to be calm.
Yeah. We have done sort of like some school assemblies before, and sort of like questions and answers. And again, the kids generally are quite respectful. They're all sort of like very keen to interact. So I'll tell them a little bit about therapy dogs. We'll also explain, sort of like how you should be behaving around dogs and the dog's basic needs, etc., and a bit of pet care. But then we also always get the questions of like, who's the dog's best friend? and how many times does the dog poo, and what's its favorite food, and we get the same questions over and over again. And then it's like, can we stroke the dog? And it's a bit like a wedding lineup whereby you're stood there and then all the kids are piling past and trying to stroke the dog as well. So that just needs a bit more coordination.
Wow. I'm sort of like lost for words because I didn't know therapy dogs did so much and went to so many different establishments. I just used to see them, and this is my bad, where they just go somewhere and someone pats their head or strokes their coat, which would tend to be an old person's home. Yeah. But I didn't know they go into all these other places. Yeah.
Yeah, so some of the we're doing an awful lot more dementia care now, and we touched on it briefly earlier, whereby, you know, sort of like the dog will help jog a memory. But what's really good is then sort of like the staff can actually use that later. So once the dog and the volunteer have left, they can then start trying to encourage more of that conversation from bygone years. You know, to try and sort of like evoke some more memories and be able to have a conversation with those people. We've also been into places where people haven't, you know, sort of like spoken properly for weeks or months, and then we'll chatter away quite happily to the dog. May not always make sense to us, but as far as they're concerned, they're having, you know, sort of like a really deep and meaningful conversation. Dog's happy, it's being interacted and played with. And again, you know, to see if that was your relative, to be able to see that interaction, you know, you're not just making a difference for the patient per se, but as relatives, you can say, okay, you know, I know that they're happy, or for that moment they were content. And I think
massive. That's huge. That's huge, and especially the things you're saying about the neuro wards as well. Like that's absolutely huge. Like you said, just those little movements, or you know, those conscious thoughts of I want to stroke this dog, or I want to look at this dog. That's massive. You know, it's not just a little thing. So that must be hugely rewarding for your volunteers as well to be there for those moments. So I have to ask, because somebody is bound to comment and ask, and they're going to say it just like they do for everything else. But what about the allergies? Somebody's going to mention allergies. We all know it's coming. So what do you do, or what things can you do to try and help allergy wise in places like hospitals and dentists and that kind of thing?
Okay. So generally speaking, we don't actually come up against it all that much, because if somebody wants a therapy dog, they're, you know, sort of like they're like, right, okay, we're gonna make this work. Occasionally we do have to speak to infection control within a hospital, but usually they're all over the dog within 5 minutes anyway, so you know, that's fine. So there is always going to be people who are allergic, or are, you know, are in a situation where they don't expect to see a dog in a hospital, and it's like, I don't like dogs, I'm petrified. So we always work with the establishment. We will go round with a member of staff. So it could be a play specialist in the hospital, it could be an HCA in a nursing home. We will visit sort of individual wards or rooms with that person, and they'll say, actually, don't go into room 15. Betty's allergic, or she doesn't like dogs, or don't go here, you know, sort of like they don't like dogs. We always ask, you know, sort of like hands are washing. Basic common sense. Please wash your hands. You know, don't touch your face. And you know, that's as good as we can get. During the pandemic, we put in an extra layer of trying to use sort of like using lucillin as well, which is a great product as a sort of like disinfectant. And we would always sort of like spray that. We need to make sure that our dogs are clean and healthy, and you know, as I suppose as hygienic as a dog can be. But no, other than that, we don't generally come up against the allergy thing.
That's interesting, because I see it a lot on posts for schools where they're like, well, why would you want to bring your dog into the school? There's, you know, there's people with allergies, you know, and you're like,
So if we're going into schools, you know, that will be one of the things. It's like, okay, what provisions have you made for somebody with an allergy? And it's like, okay, well, this class, you know, won't be in on this day, or we'll make sure that person doesn't, you know, sort of like doesn't come in. So yeah, we will work with them. But I mean, a dog is a dog, and it's as clean as we can get it. And those that can't interact, sadly, you know, sort of like they stay away. But generally speaking, most people are like, yeah, let me in.
So, do therapy dogs, when they go into an establishment, do they have to wear any particular clothing?
Yes, they need a tutu, a headband, and some fetching socks. Yeah. So the The answer to that is no. They don't have to.
Okay.
They don't have to wear any clothing. However, we, as an organisation, I think it's really important to show that this dog is working or is volunteering at the time, and that they're easily identifiable. So, particularly in somewhere like a hospital, I'm not just bringing in Fido for a stroll around the wards. We have a very sort of like recognisable yellow sort of like bandana slip, and all of our leads and collars are branded with Therapy Dogs Nationwide. It also, again, evokes conversation as well, rather than just having Fido on the lead wandering through a hospital. As volunteers, we try and wear sort of like a t-shirt, a branded t-shirt. So again, you can see that we're, there's a partnership and that we're working together. But no, we do ask that they do have sort of like the collar and lead on, so they're easily recognisable. It's then entirely up to them what other bits and pieces that they take in.
Okay. Yeah, because I think it is important that they are visible and people can clearly see why they're walking around the school, walking around the hospital. Would they also have ID?
Yes. So when you register with us and you're approved and you get to become on our books, we give both the dog and the handler an ID badge. That's renewed annually. We don't charge for any of the assessments, any of the paperwork, but once they do come on board, we do charge an annual fee of £30 for volunteer and dog combined. And that is basically to cover the insurance and the admin that we've done up until that point. So it's £30 per year, and that will cover sort of like the ID badges as well. So then people can purchase any other additional uniform and things that they will need.
Okay. Can you just say once again the name of the organisation you work with, volunteer with, and how people can get in touch with you if they want to become volunteers?
Certainly. So we are Therapy Dogs Nationwide. Our website is TDN, so Tango Delta November, standing for Therapy Dogs Nationwide, tdn.org.uk. You can find us on social media. We are at Therapy Dogs Nationwide across social media. So please engage with our posts and look us up. All the information about becoming a volunteer can be found on the website. As I say, we're not trying to catch anybody out. We will give you the details of the assessment, what we're expecting you to do within the assessment. And also, if you are an establishment and you're looking for somewhere, there's the details on there to say to request a visit. More information makes it much easier for us. So please just don't say, we are a nursing home, can we have a dog? What sort of provisions have you got? Have you got a day in mind? Sort of like how often would you want it? What sort of things would you want the dog to do? So as much information as you can give us, but again, all the information for volunteering is on the website.
Thank you. I just want to say thank you very much, Helen Humphreys, for pointing Leisl into our way, because this has been a really splendid and lovely talk, and it's given me much more of an insight, as it will do other people, exactly what therapy dogs do and all the different places they attend. So everyone watching, I hope you've enjoyed this podcast just as much as me and Samantha have enjoyed listening to Leisl. And until the next time, I just want to say goodbye from myself, goodbye from Samantha and Leisl. And if we don't see anyone in the next few weeks and months, have a great Christmas. See you in the new year. Bye for now.
Bye-bye.